they break back pain into three categories. So you have less than 1% are like red flag back pain. Okay, so things you want to watch out for there is like if you losing bladder or bowel control. So if you can't stop yourself going to the toilet, if you have like unexplained night pain, things that like just constant, like I'm not talking about like it's sore going to sleep when you lie down. I'm talking about like this thing doesn't stop or no pattern to it. It's just like a constant pain or unexplained weight loss in the last 6 months. So not that you're exercising more and you've lost weight, but like you are just losing weight, because those things you want to really check out. They're called red flags.
Right.
Less than 1%, but it's important to look out for. So that's one category of back pain. The second one is nerve root irritation. And that is about like, that's about like 7%, 8% of back pain. So it's where the nerve root is compromised, either with like, it can be a very bad disc prolapse, or something is hitting the nerve really hard, and it's causing like, a drop foot or severe pain below the knee, essentially. And then that's about 4%. And then about 90 to 95%, depending on the studies, is what we call mechanical low back pain. And that is back pain that is caused by the way we move, essentially, that we're in like too much flexion or too much extension. And what they've done is, now I still like categorizing back pain in terms of like disc, facet joint, SI joint as the main three, but they don't like that anymore. They like just saying this, like they don't want people being like, this is exactly what's causing your back pain. They want you have a flexion intolerant back, which would mean that like when you're in a flex position for a long time, that's what causes your back pain. If you're in an extended position for a long time, or that's what causes your back pain. So that's the way it's the three that are categorized. One thing I would say there on the disc is people might be like, well, I have sciatica, or I have pins and needles down my leg. If it doesn't go below the knee, it wouldn't be that nerve root irritation. Okay, so usually with that, you're talking about like, again, that you're kind of slapping your foot off the ground, that like the pins and needles is coming down like past the knee into the calf, into the foot.